So welcome everyone to our webinar. This is Impilo's partner series featuring Wesper. And just a heads up today, this webinar is being recorded and will be sent to everyone who registered for the webinar and is joining us here today. My name is Chelsie Ebling and I'm with the marketing department here at Impilo. And here with us today is Dr. Chelsie Rohrscheib from Wesper, who is currently changing the game in sleep medicine. Chelsie, do you want to introduce yourself?
Sure, and thank you so much for having us today. My name is Dr. Chelsie Rohrscheib. I'm the head sleep expert at Wesper. So Wesper is a home sleep apnea testing device, and I oversee a little bit of everything to do with sleep at our company, including working with our provider partners, research, and also occasionally consulting with patients.
Amazing. Thanks so much. We're really excited to have you here with us today. So we're going to go ahead and get started. So we're just going to go over the agenda items today. So we're just going to go into some introductions about Impilo and Wesper. Chelsie is going to dive into sleep apnea, innovations in sleep diagnostics. We're going to go over some practical implementation, which is going to feature a patient success story. And then we're going to end with a brief Q&A session. So, if you have any questions throughout the discussion, feel free to pop them into the chat and we will answer them at the end. So we're going to start off with an introduction of Impilo and Wesper. So Impilo provides the infrastructure to deploy and scale in-home patient monitoring and remote care. Our platform manages brand agnostic device procurement and deployment, technical device support, and an API integration to ensure clinical data is connected to your desired workflow. And with us, you can focus on clinical care while we manage the operational complexities. Chelsie, do you want to give a brief overview of Wesper?
Sure. So Wesper is a Type 3 FDA cleared home sleep testing device. We're also a long-term sleep health monitoring platform. So our device is used for not only testing patients for sleep disorders like sleep apnea, but monitoring their sleep apnea. We're also frequently used for titrating therapeutic devices like oral appliances, CPAP, and Inspire. And we also allow providers to get really good, high quality data about their patients so they can be uh, very secure in the knowledge that they are providing their patients with the best care for their sleep disorders possible.
Amazing. Amazing. You guys are doing great stuff. And now we're gonna get going with the bulk of our discussion today, which is sleep apnea. Chelsie, do you mind diving into what sleep apnea is and how common it is?
Yeah, absolutely. So, sleep apnea is one of the most common sleep disorders. It's only second behind insomnia. Especially in America, we have a very high prevalence of sleep apnea in this country due to various lifestyle factors and an aging population. So, sleep apnea occurs when patients have long pauses in their breathing during sleep. This is usually due to an obstruction in the upper airway that's known as obstructive sleep apnea. But it can also be caused by nervous system dysfunction, where the brain does not give the body the appropriate respiratory signals. In that case, we call it central sleep apnea. So, when patients have these pauses in breathing, they experience a sharp decline in their blood oxygen saturation. And this happens all throughout the night. When your blood oxygen saturation falls, it sends a signal to the brain to wake that patient up momentarily to restart breathing again. Now, this means that patients with sleep apnea have a lot of disturbed sleep. They have sleep fragmentation, and they tend not to get into those deeper, more restorative stages of sleep that they need to feel well rested. Over time, this can lead to chronic sympathetic nervous system activation, inflammation. It puts a lot of stress on the heart, on the immune system, and various other systems of the body. Over time, sleep apnea can raise the patient's risk for various comorbidities such as cardiovascular disease, stroke, heart arrhythmias, diabetes, certain cancers, neurodegenerative diseases like Alzheimer's disease and dementia, and a variety of other health conditions. So, all in all, sleep apnea is very detrimental to a patient's well being and daytime functioning, but it also has significant consequences for their health. As far as how common it is, so current estimates suggest that approximately 26% of Americans have sleep apnea, although most scientists and health professionals agree that this estimate is probably pretty low. And that's because most people with sleep apnea never get tested or diagnosed. So we don't have a really good idea of how many people we're actually missing each year.
Wow. Okay. Yeah. And I know that you mentioned, a lot of patients are dealing with comorbidities, and that is taxing in itself, especially with dealing with various symptoms that are similar to other ailments. So, what are the common barriers to a sleep apnea diagnosis?
Yep, that's a great question. So, traditionally, well, up until recently, when you were referred to get sleep testing to test for sleep apnea, typically you are sent to a sleep clinic or a sleep lab. So the patient would have to travel to a study site that has beds and sleep physicians on staff to monitor your sleeping overnight. So one of the most common barriers has been accessibility. So especially for individuals who live in more rural areas that don't have access to sleep testing facilities in their town, or, even up to an hour away sometimes. We also see that referrals for these in clinic sleep tests are quite long. So once your PCP refers you for a sleep study, patients can wait 3 months up to 6 months, depending on, how backed up the system is. During COVID, we saw wait times up to an entire year, and these haven't really improved that much. Sleep testing in a facility is quite expensive. It can cost thousands of dollars, even with insurance. So that's a huge barriers for people who have financial concerns. And of course, sleep testing is very time consuming. Imagine that you have to travel maybe an hour or more to get to a facility. You have to dedicate almost your entire day to getting there, getting checked in, getting all the equipment applied to you, and then staying overnight in a lab and perhaps not leaving right away in the morning. So, if you have other priorities, such as you have children to take care of or job constraints, this can be highly inconvenient. And then finally, another thing that really puts people off of getting a sleep study is just fear of discomfort. So when you go to a lab, you're connected to a bunch of wires and sensors. You've got belts wrapped around you. You've got sensors on your head, on your face, on your legs. You're also sleeping in a foreign environment and perhaps a very discomfortable or very uncomfortable bed. And so these are all things that really put people off of going to get tested.
Yeah, absolutely. And that's completely understandable. So thank you for going over those challenges with, getting a sleep apnea diagnosis. And I understand that there have been, significant innovations in sleep health, sleep medicine, and technology, which is great, especially being able to track our sleep while being in the comfort of our own home. So do you mind talking a little bit about that?
Sure. So, in the last decade or so, we've seen an introduction of home sleep apnea tests. So, these are tests that patients can conduct from the comfort of their own home in their own bed, so in their own environment. And newer sleep apnea tests, home sleep apnea tests, are very comfortable. They're non invasive. There's very few sensors that are actually applied to the body. They're very easy to use and they're super cost effective. Now, these home sleep apnea tests are nearly as accurate as in hospital studies, allowing providers to be very confident with their patient's diagnosis and testing.
Amazing. Amazing. That's great. And I know that Wesper is currently redefining sleep diagnoses with their at-home testing system. What devices do you all offer?
Yep. So Wesper is one of the type 3 FDA cleared home sleep apnea tests. Our device is composed of three components. So it's two biosensor flexible soft patches that are around 2 inches wide. So they're not very big, and they adhere to the abdomen and thorax. And when they're on the abdomen and thorax and are connected to a mobile device, they collect a wide range of signals and various data indices that provide information about the patient's respiration and also sleep quality. So some of these metrics include things like respiratory effort, airflow, pressure, body position, sleep staging, movement, body temperature, and more. And we also pair the two patches with a cleared finger pulse oximeter that's worn around the wrist and slides down the finger like a ring. And that provides us all of our oxygen information. So when we combine these components and they work together, we get information about your patient's breathing. So, how consistently they're breathing, whether they stop breathing. So, whether they're having an apnea, which is a full breathing stoppage, or a hypopnea, which is a partial breathing stoppage, and whether those breathing stoppages are obstructive in nature, meaning something in the upper airway is blocking the flow of oxygen into the lungs, or central in nature, which means that the brain is not sending the body the appropriate respiratory signals. And we also combine that information with oxygen data, SpO2 data from the pulse oximeter to see how their blood oxygen levels are actually responding to those respiratory events. And when we combine all of this data together, we can not only understand if your patient does have sleep apnea, but we can tell what type it is, and we can also tell how severe it is. We can also look at things like how much their sleep apnea is affecting their sleep quality and look at indicators for how their sleep apnea might be affecting their overall health as well.
That is really impressive. And I know how important sleep is, and being able to track all of that is so important, especially with a sleep apnea diagnosis. What are the benefits of utilizing a device like this to help diagnose sleep apnea?
Yeah, that's a great question. So, first and foremost, it removes a lot of those barriers to testing. So, this device is cost effective, it's comfortable, it gets shipped directly to the patient's house. So, it's very convenient. They don't actually have to go anywhere to pick it up. The device connects to a mobile app that is very user friendly. So the patient is guided through the setup process with images and instructions that are very simple. The device itself is incredibly comfortable. So the patches that go on the body are flexible and cushioned. So once they're on, you barely even know they're there. And obviously, the patient also gets to sleep in their own bed, in their own environment. And they get to, because they're not connected to a bunch of equipment and wires, they can sleep very naturally. They can sleep in whatever position they want. They can use anything they want in their environment, like a white noise machine, for instance. All that allows for us to collect more accurate data that's more representative of how that patient sleeps every single night. The other benefit of Wesper is we are cleared for multi-night use, which means we can test the patient more than one night and collect longitudinal data. This is really important because most sleep apnea patients have a lot of variation in their results from night to night. This means that some nights they can look completely normal, while other nights they have clear indication of having sleep apnea. So you get a better overall understanding of your patient's pathology.
Incredible. Thank you so much for going into that. And yeah, it's wild technology that we are experiencing. at this time. I know I'm wondering, but I'm sure many of us on the webinar are wondering how a device like this is implemented into the sleep routine. Do you mind giving an overview of what that looks like?
Sure. So one of the nice things about home sleep apnea tests, especially like Wesper, is, traditionally PCPs that suspect their patients might have sleep apnea have to refer them to a sleep clinic. Who knows how long they actually have to wait to get into that sleep clinic. And then they might not see the results of their patient's testing for months. This simplifies that process. So providers can prescribe something like Wesper directly to their patients. That Wesper kit gets shipped to their home within a day or two. Their patient can test pretty much immediately and follow whatever testing routine the provider has asked for, whether it's one night or multi-night. When the patient takes the test and wakes up and presses stop on the app, all of that data gets automatically uploaded to a portal that provider has access to. And usually the provider will have access to the patient's report within 30 minutes of finalizing the test. So it's a very quick turnaround process. It causes less frustration for the provider and the patient. And for patients that need to be on a therapy, you can get them started with a therapy within weeks instead of months. So it's a much more seamless and patient focused process. And I think that most providers are very excited to be able to test their patients for sleep apnea, to investigate various comorbidities, especially. We have a lot of patients who come in with things like AFib or high blood pressure, and their doctors don't want to wait to understand what's causing those things. And this is where these home sleep apnea tests can really help.
Absolutely. And I feel like that's so important in today's, healthcare landscape of getting these answers quickly instead of waiting weeks to months and, just really focusing on patient care and making sure everything is all good. Um, I see that, we did want to talk about a patient success story. So let's dive into that. Do you mind going over that?
Sure. So Wesper is primarily used for diagnostics, but it's also used very frequently for titrating devices for sleep apnea therapy. So these are devices like CPAPs, oral appliances, and Inspire, which is a hypoglossal nerve stimulating implant device. Now, I'll give you some overview in case you're not familiar with Inspire. Essentially, it's a surgical therapy where a battery, like a pacemaker, is implanted into the chest wall of the patient. And then a lead stimulator is run up into the neck and attaches to the hypoglossal nerve. The patients can turn the stimulation on and off through a remote at night. And when that nerve is being stimulated, it allows the tongue to move into a more forward position in the mouth and maintain tone, keeping it from blocking the airways and preventing apneas and hypopneas. So, while Inspire is great and it is really successful for treating moderate to severe sleep apnea, the titration process or the adjustment process of the device is very long and time consuming. So, typically taking anywhere from 3 to 6 months on average. So, this patient was seen by one of our partner providers, a 55-year-old male with severe OSA and a history of hypertension. And he was given the Inspire device because he was intolerant to his CPAP. So our providing partner wanting to see if he could get better results and a quicker titration time by using Wesper to test the patient every single time they adjusted the amplitude of the Inspire device. And so the patient would go through an adjustment, the provider would have him test with Wesper, and then the provider would review his Wesper results to see how much improvement there was. With these frequent check-ins, the provider was able to successfully reduce the patient's sleep apnea from severe to normal. And he was also able to successfully reduce the total titration time to 5 weeks. And this is compared to the typical 12 to 17 weeks. We also saw major improvements in the oxygen desaturation index, the lowest minimum SpO2, hypoxic burden, which is really helping us understand the accumulative effect of oxygen deprivation. We also saw major improvements in his scores on his sleep quality questionnaires as well. So overall, it was a big success. It saved the provider a lot of pain and reduced total chair time. And the patient was much more satisfied and less frustrated with this titration process.
Wow, that's amazing. That's pretty powerful. Thank you for sharing that patient success story. It's so great that we have these at-home diagnostics to really improve health no matter where you are, especially when it's something like this. Awesome. Well, let's get started on the Q&A. Some have come in, but if you haven't had a chance to type in your question, feel free to do that right now as I pull them all up. All right. All right, Chelsea. So the first question looks like, do you need a doctor's prescription to get this device?
Typically, yes, especially if your patient is looking to cover this device with insurance, then a prescription is the best way to go about it.
Okay, perfect. Looks like the next one kind of plays on the first one. Does insurance cover this type of at-home testing?
Yes, most insurance policies will cover home sleep apnea testing. Approximately 50%, honestly, by now, probably more of sleep studies are done in the home. And they are considered completely standard for sleep apnea testing. Insurance is very proactive about getting people tested and treated for sleep apnea, specifically because it has such a high risk for these long-term chronic comorbidities that they see this as really important preventative medicine. So yes, most insurance is very willing to cover these sorts of sleep studies.
Okay, awesome. The next question looks like, is there a difference in accuracy in an in-lab study and what Wesper offers?
That's a really good question. So, to get FDA clearance, home sleep apnea tests have to be validated against in lab studies. So, what this means is we have to run clinical studies where a patient simultaneously undergoes an in lab sleep study while wearing the home sleep apnea testing device. And then we compare the results between the two. When Wesper was validated, we showed 95% accuracy against an in lab PSG. That was a few years ago. Our accuracy has increased since then. And we also have very high auto scoring accuracy, which means that the accuracy of our algorithm automatically scoring the patient's sleep tests without them being reviewed by a human.
Amazing. Thank you for answering that. It looks like we have two more. If someone has a pacemaker or other medical device, can they still use this?
Yes, absolutely. So just like the hypoglossal nerve stimulator that I spoke about earlier, that pacemakers also have a battery that's implanted in the chest wall. Wesper does not interact with those devices whatsoever, or really any other medical devices. The only issue may be if a medical device is placed where the patch needs to be placed on the body. We rarely ever see this being an issue, if ever. But if you have any questions at all about whether or not Wesper is likely to interact with another medical device, I would advise you to reach out to our support team. They can answer any questions you might have.
Awesome. And I think we have time for one more question, and then I'll populate all of the emails on there as well if you have additional questions. Someone wants to confirm that it can perform a CSA diagnosis.
Yes. So CSI stands for essential sleep apnea. The amazing thing about Wesper is because we're doing direct respiratory detection, because the patches are going on the abdomen and thorax, and they can actually detect with very fine sensitivity respiratory effort, the patches can differentiate between an obstructive event and a central event. So I'll kind of explain how that works. So when you're having an obstructive apnea, even though you have a pause in your breathing, you're still trying to breathe. So you're still trying to breathe through that obstruction. So you still have respiratory effort, and the patches detect that. Whereas with central sleep apnea, there is no respiratory effort because the brain is not sending the body the appropriate respiratory effort signals. So if we see a pause in breathing with zero respiratory effort, that is classified as a central apnea. In our reports, we provide all of the information needed to understand how many obstructive apneas versus how many central apneas that individual is having. And we provide the apnea hypopnea index, which is the standard for diagnosing obstructive sleep apnea. We also provide the central apnea index, which is similar, but it's looking at central apneas specifically.
Okay, amazing. Thank you for answering that. Um, and if you have any more, feel free to quickly pop them in. If we don't get to them, we will just contact you one way or another to make sure that that gets answered. But that wraps it all up for our webinar today. Like Chelsie mentioned, any other questions, support at wesper.co. You can also reach out to them at sales@wesper.co. Their website is listed here as well. If you have any questions on the Impilo side, definitely feel free to reach out to us as well. And I want to thank you for joining us today. And I know I learned a lot about sleep apnea and the innovations in sleep diagnostics. So I hope everyone who attended also learned as well. So thank you so much, Chelsie, for joining us.
No, thank you so much for having us.
Absolutely. All right. I hope everyone has a great rest of your day. As a reminder, this was recorded and this will be sent out in the next day or two. So I hope everyone has a great time and we hope to see you again soon.